So I thought I'll sum it all up by saying that what is the main determinant for somebody who does well in life? What is the main determinants? So if I put them into 4 small components, the first component for anybody doing well in life is, anybody? That is knowledge. You have to know what you're doing. Now, you can't just be, I have seen people who would be smart, who would want to be good salesperson, who would want to be selling things, but if you don't have knowledge or the basic skill set required for your own thing, you can't do well. So as a doctor, the first and foremost important thing is knowledge. But is the knowledge enough? What is the second thing that you need? If you have knowledge, what do you need? The second thing that you need to be successful in life is thinking process. Many people have knowledge, but they do not know the thinking process behind that knowledge. So when it comes to applying in real life situations, they're not able to apply. So you need knowledge and thinking process. But is that enough to have superlative success in life? You have knowledge, you have thinking process. What else do you need? What else? What else? The third thing that you need to do well in life is emotion. So I've seen many people who are having knowledge, who have thinking process, but they have no emotional drive to their journey. You understand? Kabhi dekha, somebody will say, "Ye mere papa ko bola, main ye karke dikhaunga." What is that? Emotion. You understand? So everybody would have, if you have something that is driving you forward, that is your emotion. And when that emotion becomes mad, what does that become? That becomes passion. So what is passion? Passion is I want to do this, whatever happens, I don't care, I want to finish it. You understand? So when you add emotion, you start winning big. When you add passion, you win even bigger. What is the final component? What is the final component? You have knowledge, you have thinking process, you have emotion. What else do you need to win? What is the final missing piece in this jigsaw puzzle? Anybody can tell me. I've learned all this over the years, but what is the final jigsaw? That is attitude. That is attitude. Attitude is that some people have a winner's attitude, some people have a loser's attitude. If you see, if you notice, as soon as you see a tough question like we projected for you in this quiz, so as soon as you see a tough question, some people they say, "Arey, I don't know all this." Some people sitting in the audience, they said, "Arey, let's go back. This is not for me. This is so tough." But some people they stay on because they know that I am learning always. I may not know everything, but I have a learner's attitude. It is not about winning and losing, it's about learning. So that transforms them into constant learners. How big is medical science? How big? Anybody? How big it is? It is massive. It is huge. It is immense. Do you think one lifetime will ever be sufficient for you to learn the entire medical knowledge? Never. So who are the people who will win in the end in the medical field? Who will do big things? People who remain constant learners. People who have attitude to constantly learn. So these are the 4 components of learning. What are those? Anybody? Anybody? Final? Knowledge is not enough. Add thinking process. The knowledge thinking process makes you a boring person with no drive, no emotion. You need emotion, you need passion, and then you need attitude. You add them all together, you win massively. This is what I learned in this institute. I started in this institute as an undergraduate. The only thing I had was emotion in the beginning. No knowledge, no thinking process, only emotion. Kuch karna hai. And that emotion gradually drove me into acquiring knowledge, then acquiring the thinking process, and in the end, what helped me in the long run was attitude. I don't get disheartened if I'm wrong. I always think that I'm learning. That is the way forward. I wish you all the best. It has been a pleasure to come back to this institute again and talk to students.